Hey everyone, Lisa Chase here with Danny Lynch, one of our physical therapists. And look, we get so many questions about dry needling. So I really, wanted to have a conversation with Danny so we can really answer the very common questions that we hear time and time again. So the first most common question, as we know, is what is dry needling and how is it different from acupuncture?
Sure. It's a subtype of acupuncture. So acupuncture literally means the puncture of a needle through the skin. Dry needling is a subtype of acupuncture in a Western medicine approach of just applying a thin filiform, really thin needle. It's about the width of 2 or 3 hairs, human hairs, into the skin, through the skin to the depth of a muscle, a bone, a ligament, tendon area, fascia, etc. So it's essentially the same type of needle, and I'll show you a needle that an acupuncturist uses, just longer, and I'm treating anatomical and neurophysiological Western issues with medicine. Oops. You okay, Buzz?
Sorry, you're killing us.
So acupuncture is an Eastern medicine where they're treating qi along meridians. So they're following a bladder line, a stomach line, and they're treating systems of the body. It's a different field, different approach. And they're typically going to the depth of the skin. They're not usually going to muscle. They can, if they do additional coursework in dry needling. Acupuncturists do take some of the dry needling courses that I've taken, and then they learn, therefore, how to address anatomically through a Western approach dry needling. There is such a thing as wet needling too. So we call it dry needling simply because I am not putting in or technically taking out anything from the body. There's no injectate, there's no medicine in the needle. It's just a dry needle.
So we see a lot of patients that have pain, they have disability with being able to move, difficulty with activation of exercises. So let's get into what does dry needling actually do that it's going to help, these different types of conditions.
Sure. And I would like to kind of separate it. There's a cellular effect, a local effect, a regional effect, and a global brain effect as well. There's so much that goes on. Most of it we understand at the cellular and local level, but there's some things at the regional and brain level that are really cool, and we've just noticed work as far as pain modulation. But I would say let's start at cellular. So I'm inserting a needle, and I guess the most basic concept is, what am I mechanically doing when I'm putting in that needle? So if someone comes in and they're just have this thing, we usually call it a trigger point, an area that's not moving well. It's like an inflamed taut band of tissue, and we identify it and we put a needle near it or in it, let's say. There's a spasm reduction that we can create with just the insertion of the needle, this little sympathetic response, and literally mechanically I'm disturbing an area of tissue, and then either pistoning, bringing the needle in and out, tenting, kind of twisting the needle and pulling away, or even just a winding effect, which is what I do a lot of. I know you do a little more pistoning, and I do some more winding, where I just put the needle in pretty quickly so you don't feel it too much. And then I twist the needle a little bit, and it kind of grabs the collagen around the needle. And if it's truly dysfunctional area, you'll feel almost like a stickiness. Like I'll try to pull it out and I won't quite move. And so that is literally grabbing collagen around the needle and winding it. And hopefully, as I wind it and mess with it and leave it in and then come back and mess with it, it'll break away the lazy collagen. Like you do in a workout, we create little micro tears when you're working on a muscle group that you haven't in a while, right? And eventually the body will send its phagocytes and all its cells to reabsorb that material and get it out of there, and then rebuild stronger and better eventually. So if you're looking for the immediate effect, see some immediate effect with dry needling, you can see a lot with that cellular level of just, I'm literally deforming some collagen that's not working right. You can also, that insertion can also locally disrupt kind of a spasm, which is just a dysfunction of the motor and plate between the nerve and the muscle. It's this repetitive release of calcium that's causing this repetitive contraction of muscle, and I want to disturb that. It's dysfunctional. So sticking the needle in we kind of understand why it works, but it actually can stop a spasm like that. So that's kind of what cellularly is going on. Then you got all these local effects. So I'm going to go into the local effect now a little bit. So on a bigger scale now, from that little collagen level, now we're going to like increasing blood flow to the area, which is a huge thing. When you have something not moving in the body, like a trigger point, it creates like this hypoxic environment. It's a lower pH, and there's not enough oxygen getting to the area. And so I'm literally stabbing, creating this full systemic effect of, I just got stabbed by something. I've been hurt. I've been wounded, but on a micro scale. And so now I'm going to send a bunch of my agents to the area to kind of increase the blood flow to the area and send a march of our inflammatory cascade cells that always go with a normal functional immune system response to injury. So if I want to get to an area specifically, a specific muscle that's not moving right, that's hypoxic, that's just bunched up or just not contracting right, putting that needle in creates this like local and then regional response to the body to start that immune process and start a healing process. And we've seen it in many studies, increasing blood flow days and days after just a few needles in an area left in the body, maybe 15 minutes. Huge benefits with vasodilation. And so that comes with so many things that I could take 3 hours and explain. I mean, yeah.
Right.
So there's that local response. And then there's endogenous opioid release from the brain, and some really cool both regional and global effects. So we go on the bigger scale now. What else can we do with needles? We can go into what we treat a lot as therapists. Like if I have let's say a biceps dysfunction, right? I have either pain or I'm just not activating my biceps as well. It's a lot weaker than my other side. And let's say I find this chronic problem worth a needle or a series of needles. I will actually needle by the spine, maybe, like the corresponding nerve root level, into the muscles around that nerve root area, like the paraspinal muscles or deep back muscles. And I'll put the needles in there and connect E-stim from that area above the problem to the problem or just above the problem. And I can create a whole slew of changes with muscle activation from the root of the problem. So that's like a regional, we call it regional interdependence in therapy. So we'll do joint mobilizations and other treatment to the area above the muscle group. Yep. And so needles give us this really cool tool to re-educate the neuromuscular system as well.
Yeah, so, I think you know what's important about that point is kind of the whole body approach, right? Exactly. So instead of just constantly only treating the area of pain, what we're doing is trying to look at the whole system, see what's influencing it, and the needles can be used to help facilitate that.
Exactly, especially if someone can't do the motions we need them to do. It's a passive tool. It's a tool for us to, you know, really cool effect. And then we can couple it with E-stim as well.
Yeah, which is great. So let's talk about, you know, people might be saying, so is dry needling right for me? Like, when would you use dry needling and like, who is it best suited for?
Good question. Again, always you start with the patient's preference. It's your body. So if I determine there's no pressing aversion to needles, that's where I would start with, then I kind of go from there. Just take myself for just a quick example. I don't like giving blood. I kind of used to look away, and now I can look because I've done so much needling, but like that's a huge gauge of a needle to give blood. These are really small needles. So I'll just first kind of gauge the patient's comfort, because that is the most important issue. Are you okay with the needles? And then we just kind of show you the difference between the two. And most often people are willing to give it a try. If you're in pain, you're probably going to give it a try. And it's really, I mean, I've poked everywhere on my body learning this process. And it's, if someone like me can do it with that initial aversion to having blood drawn, you can condition yourself. I mean, it's not horrible. It's just do you have the willingness to be needled? That's the first and foremost. So if you have that willingness, we go from there. And it's really pretty open. I mean, I've needled an 8-year-old to a 95-year-old. I mean, it's kind of across the board. There is always the need for the indication, right? So I'll just kind of list a few common people I needle or reasons I would needle. Again, a tool. So I would say tendinopathies, like chronic pain, stuff that's not healing. I love it for chronic strains in a muscle. Muscle's that kind of permanent tissue. It's not as labile as skin is. It doesn't heal as fast. So with muscle tissue that scars easily and takes a long time, I've helped people heal like chronic, like adductor strains where they have this literal knot that doesn't go away for 7 months, which is abnormal. And you put e-stim above and below, put the needles into the adductor, e-stim connect with some channels, and we get great results within like 2 to 6 doses of it. And they're back to doing roller derby or whatever it was they were doing. So we have wound healing, we have tendinopathies, we have just neuromuscular dysfunction, like drop foots, certain types of drop foot, vague abdominal pain that's not caused by an organ. It's truly like a muscle issue, ligament tear, ligament sprains. I have like range, trying to get a little bit of range if I have a trigger point area, needling that, which is probably the quickest. And then a lot of really cool things like headaches and facial pain and trigeminal neuralgia and even wound healing. We're using it a ton as well for skin ulcers and such like that. So there's just so much. And bladder retraining, pelvic floor dysfunction. I could go on and on, but there's nerve dysfunction, ligament, tendon, muscle.
Yeah, it's really
it's very versatile.
Really great tool, and we can use it in combination with so many things.
Yes, it's a combo.
And it does oftentimes give you a very quick response. So let's talk about, so somebody's interested in doing dry needling. So how do they prepare? Like what are the things that you talk to your patients about?
Sure, I gauge, their comfort level, sure. But then I just talked about like, okay, you just have to be comfortable with, you're going to be with me. Most of the techniques I do take like 15, 20 minutes because I put the needles in and I leave you on ear stim. So are you comfortable in belly down position, sitting up? Do you ever get faint with a needle insertion? So I know where to position you. So you just be prepared to be in a sustained position. And I'll pillow bolster you accordingly for about 15 minutes. So be prepared for that. And then wear loose clothing. If I'm needling shoulder, I will probably have you take off your shirt. I can't be like, moving shirts around. I need the area clear. And then we appropriately drape as well. We'll put a towel on you or a gown or shorts. If I'm needling your leg, please, loose shorts is way preferable because if you're in tight pants, I'm going to have you change into a different pair. So just come with loose clothing that you're okay with taking down, moving a little bit and being draped. And then I would just say be prepared for a little bit of potential soreness. Some people feel super loose coming off the table. Some people feel tight. If there's a chronic issue and I have to put more needles in, thus a higher dosage, you might have a little bit of soreness, kind of akin to that delayed onset muscle soreness you get with a working out. That's what I'm trying to get it probably under 2 days from now. I kind of gauge what the problem is, how many needles I'm dosing you with, and then I'll give you a better estimate of if you will be sore, if you won't be sore, if you have a little delayed onset. So just a little prep for maybe some soreness because I am poking you. Yeah.
Yep. And as you mentioned, like there are different types of dry needling.
Yes.
So yours tends to be a little less, make them less sore. But you also can use the needle like we talked about where we're doing a pistoning effect, which is actually not leaving the needle in and it's much quicker.
Right. In and out.
But it can make the muscle a bit more sore. So depending on what we feel is going to be best advantageous for the patient, we will select that. So let's talk about the soreness and how we recommend patients, deal with that when it comes to, okay, now we've done the needling and now they're going home. What are you telling your patients is best?
Sure. My main rule is, I've not said I've never used ice, but my main rule is I'm creating an inflammatory process typically with what I'm doing. So please don't take any like ibuprofen or nonsteroidal anti-inflammatory drugs. That would counter a lot of what I'm trying to get. Is definitely for the first session, I would say. But if you really need to, I would say try heat, or I can maybe, sometimes we do some laser and some, massage after the needles, us personally. But at home, yeah, you're trying to like let it happen. And then if you have excessive soreness, occasionally I let people do some ice, but usually it's just no NSAIDs, and yeah, kind of rest. And then I typically, there are instances where I let people work out after, and they're usually when they've been needled before and they've been doing a dosage and we're weaning off a dosage. But the first time I tend to limit the exercise, and I tell you in the session, like, hey, yeah, don't go run a marathon right now or whatever I'm trying to do, because I want things to happen without excessive soreness.
Yeah. And I think that brings up a good point about athletes. Like athletes really do love, dry needling effects, let's say, not necessarily always having it done. And I know when I worked on the tour, we would have players that would come into the training room and we would do needling, obviously not right before a competition, but, they saw those immediate results. So, it does help to like reactivate a muscle or relaxes a muscle so they can stretch and maybe recover, quicker. So definitely can be used in that kind of setting as well.
It can, yes. Yeah. And so it depends. It really does.
Yeah,
but yeah,
it does, definitely. What other questions do we have?
The next one is this a one and done treatment?
Okay. All right. So, we know what great effects that dry needling has, but is it really like a one and done type of treatment? I mean, we're going to do it one time and then you'll be done?
For me, usually no. It's usually expect 2 to 6 doses, sometimes a little bit more if the problem is in multiple areas and I need to do multiple treatment areas. No, I say usually I would see an effect by the second, if not the first treatment. I would see something changing. So I usually like wait till the second, and then we'll see, if things are going in the direction I want. One and dones, the only like solid example of one and dones I've had, I think, are like plantar fasciitis cases. That was actually my case. I did a needling protocol for plantar fasciitis on my foot, and a few patients that had true overuse plantar fasciitis, and they get off the table with no pain at all. And I'm like, well, I might not do it again. I might have gotten what I needed to just with that insult to the fascia area with just the needle. So that's like, I say 1% of the cases. I usually dose it a little bit more with what the techniques I'm doing. If it's a trigger point release, I'm trying to get that long twitch response and just let something go in a 1 or 2 needle deal. Maybe it's a one and done, or maybe it's a one and maybe we'll revisit this later situation.
I mean, I think
answers your question.
I've definitely seen, on occasion you do, 1 or 2 muscles and it restores things. And then with the other techniques that we do, we're doing manual therapy, we're using newbie, we're reactivating the muscle. So when I think of one and done in therapy, it's, the one and done is, can I restore movement and get somebody out of pain and reactivating the muscle? That I can maybe do in one session, right? Yeah. But then I need to take them further, right? Which is now restoring their movement patterns and, getting them back to sport and all the things that we want to do so it prevents the injury from happening, again. So,
right, which is super important. I mean, this is an adjunct to that.
Yeah.
But yeah, like if I'm doing chronic pain, sometimes it takes multiple doses, and then you combine with other therapy. You do exercises to teach that muscle how to work properly the next time. Yeah,
exactly. So because there are places that maybe just do dry needling, and then there's not the other things that follow up. So although dry needling is a very effective tool, I think again that whole body approach and using the different technologies, I think, is what gives our patients the best outcomes.
Yes, and you'll see that in the research too, in the high quality randomized control trials. They're not just doing dry needling. The ones that really work, you're combining multiple treatment, physical therapy, movement, manual therapy, exercise, all that.
Awesome.
And then the last thing was just talking about the A-stim or E-stim, and then the dry needling.
Oh, the E-stim, which we
what was the question?
About the electrical stimulation.
It wasn't a question, it was more like
because you did talk,
combine
you
it.
talked about
why do I?
Okay,
Yes.
so all right, so you mentioned using electrical stimulation, which you refer to as e-stim, right? So when do you decide I'm going to use electrical stimulation with my dry needling versus not?
Good question. I E-stim, the short answer is it's a really amazing subject, which is worth its own discussion. Um, it compounds the effects of the needles. I get a march of cells. Cells are polarized, and depending on what stage of healing we're in, I want positive negative flow or negative positive flow. It helps with the march of cells as well, and it covers a greater surface area. So, if I'm trying to get deep, like a meniscal treatment inside the knee, I would use two channels to cross the current and get a deeper density down of current to go into the joint line. And that's a specific technique. So e-stim helps me do that. So I can put less needles essentially and get the same X marks the spot covered, the same location covered with the flow of current and charge and cells to the area. Good healing stuff. So, and then I tend to use it for, again, wound healing. It's great for wound healing, and you should do it. Bladder retraining, we use it. And I would say neuromuscular activation. So if something's not firing correctly, like let's just say I'll pick bicep again. So if biceps not firing together, I put like some needles in brachialis in the biceps muscle, and then I will put a few by where the biceps innervation comes out, essentially in the paraspinal muscles, right in the neck. And I will connect a channel of e-stim to that so we can get the flow of current to that muscle. And it's a different, there's different frequency settings. I'll just show you. I use like an e-stim unit, and I have a lot of channels where I connect the little alligator clips to the needle itself. And so if I'm trying to retrain a muscle, I'll set a certain frequency and pulse duration on here, and you'll actually see the muscle twitch with the needle insertion, and you just lay there and let it do its thing. And we're just retraining a few processes in the brain, in the spinal cord, and then in the muscle to just fire correctly. And so that's a time I use a lot of e-stim, is to retrain a muscle how to work properly.
All right, so people always ask, like, oh my God, like, what does the needle look like? How big is it?
Mm-hmm.
So let's show people, like, it is a very small needle, as you mentioned, like it's an acupuncture needle. It's that same small filament. So maybe just show up close what the needle looks like.
Okay, I can do that. So it's a very thin filiform needle. This is the guide tube. So I usually push this little plastic piece into the skin first so you feel less of the needle. And this is the needle. It's very thin. I'm going to put it against my skin so you can see how thin it is. Can you see that?